Welcome to another episode of FHIR podcast, where we talk about all sorts of things, interoperability and fun fire standards, and getting to know all the different personalities in the industry and folks that have a lot of interesting stories to share and a lot of takes, hot takes and spicy takes on what's going on in this space. So Pooja Babbrah, thank you so much for coming on this podcast.
Yeah, perfect. Well, thanks so much for having me. I know we took a little while to connect, but glad we had an opportunity to. Pooja Babbrah, I'm the Executive Vice President of Strategy and Industry Alignment for NCPDP. I have been in industry, I realize it's going to be 30 years now, as kind of on the strategy and product side of healthcare technology. I started my career in early days of e-prescribing. So I used to work for a PBM, and we used to send out Palm Pilots to try to get doctors to e-prescribe. So this was even before the SureScripts network got started and all of that. So as a product manager, we'd send out Palm Pilots trying to get doctors to e-prescribe. I was the one that would call them in a couple weeks and be like, hey, how's it going? Are you using the Palm Pilot? And they would say, yeah, I wrote a couple prescriptions and then I gave it to my kid. So it was, obviously a very, very slow start to e-prescribing. We got regulations in place, and that's really when it took off. So yeah, my background has always been in product management. I haven't always been in the pharmacy side. I kind of did different stints. I was working with a lab company when it was early days of trying to get lab data electronically. I worked for a practice management system as a product manager. So kind of all different places in healthcare technology. Have been with NCPDP, so the Standards Development Organization, for a little over a year now, but spent about 10 years in consulting. And so I was with Point of Care Partners, a pretty well-known, I think, shop in the FHIR world. And of course, my prior colleague, Jocelyn Keegan, and I did a lot of strategy consulting. And so was introduced to, all the accelerators over in HL7. But of course, my passion has always been on pharmacy. So ended up at NCPDP, heading up strategy and really driving forward how NCPDP can make sure that we are aligning with things going on with FHIR and with other standards and just with industry efforts around interoperability. So yeah, that's my background and what I'm doing now.
That's awesome. I love that you have a long history of not just pharmacy, but also other areas. So you can see the progression over the years. Fun fact, I also came from pharmacy. So I walked into a retail pharmacy chain called Duane Reade when I was going to school in New York City. I worked there until I graduated and got my degree. And then I got my first job out of college at Medco Health Solutions. So
Okay, so I was at PCS,
remember.
so yeah,
You probably
I bet we overlap there too. I was at PCS, so yes,
Yeah. So I was
longtime
on
rivals, right?
I was on the Medicare prescription drug plan there when
Okay, yeah,
they were then merged with Express Scripts, obviously, and then
yeah,
and so that's how I kind of got started in the industry, funny enough. And
okay,
that was my first exposure to data and BI tools and analytics and
yeah.
all that, which is funny in the pharmacy side. Why is pharmacy so important in the US? Can you give like your very simple explanation about that? Because people talk about
Yeah,
pharmacy that's like, oh, it's pharmacy, but it's like it's actually like a huge chunk of the healthcare whole industry, right?
yeah, absolutely. So first of all, I love that you worked at Medco. I think that's great. So yeah, you get this world. Well, so many things around pharmacy, right? And I think, people think of, hey, you go to your pharmacist and they're dispensing your medication, but there's so much more behind it, right? They are looking at, so many things in terms of, what other medications are you on? They counsel, they can manage people's chronic conditions. We saw during the pandemic, right? They were on the front lines of not only testing, but doing, the COVID vaccinations. We've now opened it up so pharmacists can do any vaccination on the CDC, vaccine list. So the pharmacist plays such an important role beyond just dispensing medication. There have been studies and studies and studies out there of how if you bring a pharmacist onto the care team as a true partner and help with care coordination, how much outcomes can improve. And I always, when I was consulting, there was this great story of how a large health system decided to partner with community pharmacists. So as patients were getting discharged from the hospital, they were brought in to help with the coordination of care, and they were able to improve readmissions to their hospital significantly by just partnering with the pharmacist and outpatient pharmacist of saying, hey, this patient's getting discharged, right? Can you just make sure they have their meds, check everything, make sure they understand, right? What, and, get rid of meds that they may not be taking. Pharmacists really should be viewed as a care team member and not just dispensing medications. And, even though we're a standards development organization, we're trying to support to make sure that people realize that. And everything we talk about with clinical data exchange, right? Like TEFCA and QHINs and nationwide data exchange, we need to get pharmacists right in the middle of that too, right? Not only
Mhm.
pulling patient data, but sharing back as well, because they're such an important part of the care team.
Absolutely. So, why do you think fire is important for pharmacy?
Yeah, so it's interesting, and I think this is a great place to kind of bring this to the table. I don't know how many times I hear people say, "Can't we just do everything in fire?" Right? Like, why is NCPDP's standard still out there? And I'll have to say, first of all, like I think that NCPDP, part of the reason I think we don't get enough visibility is we've been doing real time transactions for 40 plus years, right? So a pharmacist is not going to dispense a medication unless they know that they're going to get paid for it. So we have real time adjudication of claims, right? We have real time pharmacy benefit check where, right within the EHR, the doctor can ping the PBM and get what it's going to cost out of pocket for the patient. Prior authorization, right, is a huge topic right now.
Mhm.
And, we are trying to, our standard's been out there for 10 years and people are using it real time and prospectively to say, we'll do this more auto adjudication, right, to get the approval immediately. So I think in that realm, our standards have really been on the pharmacy side. Now, what we're starting to see, because we're seeing pharmacists do more clinical services and be a greater part of the care team, now we're starting to get into that more EHR data and clinical data. And that's where I see the FHIR standards and NCPDP standards kind of working together, and why pharmacists need to be aware of the FHIR standards, because so much of that clinical data is living in the EHR. You're going to be able to pull that using FHIR. And so that's where it's been interesting, because even before joining NCPDP, I was on the board. And what we used to talk about is, we're not going to try to build a clinical standard, right? That data already lives in the EHR. What we want to do is figure out how we can use FHIR to pull that data to then match up with our standards and then move things forward. So I guess just kind of stepping back, like I look at everything as a workflow and like which standard is going to fit where. And so that's why I think FHIR is so important for pharmacists as they start to move more in the clinical world, right? And being able to connect just like a provider, right? Being able to share the same data with providers, with payers, all of that I think is really, really important. So that's kind of my my I think such an important message to get out there.
That's great. I think that one of the things that people don't realize is that we've had connectivity in the pharmacy space for quite a while, actually. It's just been enabled by the NCPDP standards, essentially.
Yeah.
But it's not that we don't need fire because we have
Yeah.
NCPDP. It's actually, I think it's probably like to your point, like it's complementary and it's
Yeah.
actually makes it much more valuable because you do have these two things kind of coming together to give you the full picture, kind of longitudinal picture of the patient, right?
Yeah, exactly. And I think, too, like a perfect example is prior authorization, right? So now everyone's saying, hey, how do we make it easier for providers? How do we lower the burden on the patient as well? And the way I think about it is, even if you're writing for a medication and you need to get that prior auth on the pharmacy side, you may need clinical data, right? To
Hmm.
show to the payer, hey, I ran this lab test or I did this. So, even though
Yeah.
you're using maybe an NCPDP standard, if you can pull that clinical data using FHIR and, put that into our standard, send it to the PBM, right? That's just going to make it easier for them to approve that prior authorization. So it's not an or, right? It's an and. So it's always kind of, hey, pharmacists and providers. I think the other great example is we have a pharmacist e-care plan, and so
Mhm.
that allows pharmacists to capture clinical data to share back to a provider, right, on the care plan. Maybe they're taking care of a patient. They can send it to the payer, and even that, we've balloted at HL7 a FHIR-based pharmacist e-care plan, and
Mhm.
most of the pharmacy systems are using the FHIR-based one. It is very important for our industry and pharmacists to really understand, fire and the impact of it.
Absolutely. That's music to my ears, as you say,
Yeah.
is because one of the things I have to like do all the time and explain in my day to day and in my work experience over the last 4+ years that I've been kind of working with fire is
Yeah.
what is it and why is it important? Why should we care? I think you still have a significant amount of companies in just healthcare in general that are
Mhm.
not don't know where to start, have not done anything with fire, have never invested into fire, right? So you kind of have
Yeah.
this ecosystem of folks that have done things with it, but then there's probably the majority that have not, right? They've done kind
Yeah.
of like your checkbox compliance. So I think
Yeah.
it is
Yeah.
powerful to now start talking about these things like the e-care plan, right? That people may not be
Yeah.
familiar with, but it's like, hey, we're actually standardizing how these care plans can be exchanged with pharmacy, taking a greater role in that, which I think is huge because like we know we have a shortage of primary care physicians in this country, right? We
Yep.
have a shortage of hospitals. We know that with all the changes happening, right now in the
Yeah.
healthcare landscape, there's going to be a lot of challenges in getting the care you need as a patient. So one thing that is there to kind of, I feel like, to stand up and help is the huge pharmacy network we have across the country, right? So
Yeah.
all the
Yeah.
pharmacists that
Absolutely.
are
Yeah.
they have the patient at heart when they fill those medications. I know when I
Yep.
go fill my kids' medications at my neighborhood Giant Eagle pharmacy,
Yeah.
they always ask me, did you get all your refills? What else do you have out there? Who is this for? They're already a part of my life, right? So it's like
Exactly. Yeah.
it just makes sense that they would know like, oh, this is why I'm using this medication because I'm trying to deal with
Yeah.
this. I'm
Yeah.
actually like something that unfortunately is that I just recently had my physical and I've
Oh.
had my cholesterol got uh to a point where I can't no longer not do anything,
Oh.
like not take any medication. So now I'm on a
Right.
statin, like,
Yeah.
and I have to start taking, you know, 45-year-old male, with high
Right.
cholesterol. So
Yeah.
unfortunately, I'm going to be going to the pharmacy more often now
Pharmacy.
to
Yeah.
refill
Every
not
month.
just
Right. Yeah.
yeah, not just my kids, not just my spouse, but
Yeah.
myself. And it's a huge part of my life. And it's like, I want my pharmacist to know like what's going on and all of
Yeah.
that. And so that
Yeah.
leads me into the big discussion we're having now
Yeah.
with OpenAI and now all these things where data is going to flow into AI, right? And
Yeah.
ability to connect that data to all these other apps. And
Yeah.
let's just dive in. Let's talk about that one. I'm sure you're itching to,
Yeah.
you know,
There's a lot going
talk
on
about that.
there, right? Yeah. Yeah. Well, and one thing though, I do want to go back to, you mentioned kind of the shortage in providers, right? And if you look at the rural health money that just got distributed to all the states, we just
Hmm.
did an analysis, and I think 15 of the states actually had pharmacy specific, items in there, right? Whether it's
Yeah,
telehealth or, if you think about in rural areas, right? They may be 40 miles away from a provider, but the pharmacist, there's usually a pharmacy, right, in the
yeah,
community. And so I think that is so important. But yes, AI, all of that. I think on the pharmacy side, one thing that I keep hearing over and over again as I'm here at NCPDP is, how do we make sure the patient has access to their full med list? And I know there's so many people trying to tackle that. A lot of people using AI, right? I know there's a FHIR IG that's been created for transitions of care. So, like, how do you capture that information? I know there's work being done in Texas to say, how do we do MedRec and make sure, to me, like the patient, right, is the one that should be able to keep their med list. I being in the industry, right? We know, okay, so my mother-in-law lives with us, and I'm always like, hey, pharmacy, she's not taking that anymore, right? She's not taking that. And I still get refill. like refill notifications for something. It's definitely gotten better where, if I tell them, they actually stop it. But, on her phone, I have all of her meds, right? Through the Apple Health app of FHIR, and we stop them. And so we know exactly what's going on. So I feel like with AI, with getting the data, there's so much around that. One thing I want to bring up, because it just came up this week, this news in Utah, right? Of, I don't know if you saw that, but
Hmm.
physician clinic doing AI refills, right? And so, of course, our world is blowing up, right? All these text messages, what's going on? What do you think? All of that. And so when you really dive in, what's happening is they're just testing, right? And it's funny because we have a standard, right? It's like we have the refill standard where it automatically sends a note from the pharmacy to the EHR. And it's usually not the doctor, right, that's going through. I mean, it's nursing and staff that's saying yes, yes, yes. There's obviously alerts within the EHR like, hey, you don't want to do this until you see the patient. So it's funny because obviously that is a concern, right, in certain areas. But if you're looking at the basic medications, like your statin, right, that is probably, you're getting on it, you're going to be refilling it. I think that's actually an opportunity where the pharmacist could be checking, they could be doing your cholesterol check, right? Running that lab and just making sure. And if they notice anything out of whack, right, they could send a message to the physician and say, hey, don't refill this, right?
Right.
That's
Yeah.
that two-way communication and being part of the care team. But, obviously there's going to be things around prescribing, there's going to be things around refills, prior authorization. I'm going to throw that back out there because, a lot of what we actually held a roundtable in November at our work group meeting to say, how are we going to get to this 80%, right? Everyone signed that
Hmm.
pledge of getting to 80% auto adjudication. How are you going to get there? You're not going to get there unless you can use AI for things. So I think that's a big thing. But then you can't talk about that without talking about trust, right? And, then you bring in the whole trust thing. And I'm going to go off on a little bit of a tangent with trust, but we are actually also now, talk about interoperability. We started under Sequoia Project a pharmacy interoperability work group. I'm co-chairing that with Meg Murphy from SureScripts. And the reason we started that is partly because of the trust issue. And so before I joined NCPDP consulting work, I was talking to all the QHINs and I said, hey, do you have pharmacists connected? Some of them said yes, some of them said no. So I said, okay, if I'm a pharmacist, I want to get connected and I'm dispensing a medication. Can I pull down the patient record? And they're like, oh no, like that's not a treatment, right? Under the treatment
Yeah.
protocol. You're not treating. And I was like, okay, well, no, I didn't say it then, but it was like, okay, actually they are. I said, what about, managing chronic conditions? And we went through every single scenario and everyone's answers were different on could a pharmacist pull a patient record and not get in trouble, right? I mean, the biggest thing is you don't want people getting connected to exchange data and then all of a sudden they get cut off. And so this whole issue of trust is around, we also need to educate, I think, the industry on what pharmacists can actually do, why they're accessing patient clinical data, all of that. And so this whole issue of trust ties so much into pharmacists, interoperability. Like pharmacists are no different than any other provider when it comes to that conversation. And I think as we start to see AI rolled out more and more, right, it's like, how do you trust what's happening with your prescriptions? So I think it's just going to be a big, lots of news, lots of, I think, debate and discussion, but lots of opportunities, in my opinion. So, yeah.
Yeah. And I think it's a powerful proposition. It's really cool that now we have all of these kind of stakeholders coming together and people are realizing the benefit of having essentially it's like a care team, right? And so like when I'm thinking about, I actually took care of my grandfather as well when I was
Yeah.
uh, many years ago when I was in New York. I cared for my elderly grandfather who actually had Alzheimer's and he was in
Mm.
home and he lived till he was 92. But the last 2 years he spent like in a home and I came to visit him every 2 weeks or whatever. And or every week, and then I was actively managing his healthcare, right? So I was like managing his healthcare, and it's still extremely difficult to do that, right? You as a caretaker, not only do you take on the burden of doing this and caring after somebody, right? And having to schedule all their appointments, have to manage their medications, make sure that they have the right providers, seeing them, right? And then when you get the older, you know, your family member gets, the harder and more expensive that gets, right? And it's probably
Yeah.
true also for the healthcare system at large, that's probably the most, chronic conditions, the most expensive sort of members and patients out there
Yeah.
contributing to the cost. And one of the things we do one of the things that we can do is effectively use the power of all the care team kind of members to help
Yeah.
the caretaker to do that. So they're not alone. They're not on their
Yeah.
own to do that like
Yeah.
I was when I was managing my grandfather's health.
Yeah. Yeah.
And I think that's where also interoperability and FHIR and AI, now we get into open AI, that's where I think really the opportunities, it's really not in the just connecting the data, it's what
Mhm.
now you can do,
Yeah.
having that data be available to AI as a partner to you as taking care of your own health, but also increasingly we're taking care of others' health. Like I also take care of my kids' health, and constantly looking for different answers to
Yeah.
questions and
Yeah.
so all kinds of things. So like, what do you
Yeah.
think is that holy grail of, in an ideal world, this whole new dichotomy of, AI being there as I would say, a proactive assistant to the patient and to family members.
Yeah.
What do you think that holy grail is if we can get all this data connected and what do we do with it?
Yeah, well, I'm a huge, huge fan. I know a lot of people are like, I would never upload my record or this. I mean, we've been doing that with Chat GPT for the past,
Yeah, I've been
like in
doing
our
that for
family,
like
my husband's always like, upload this, upload that, right?
this
Like,
is actually great. This is great because it'll save me like from having to probably like totally in an unsecure way, like just going
right.
into my chart and just like copy
I
and
know.
pasting all the labs
Copy,
in
that's what
there.
I
And
do.
it's like, I don't care at this point because the value I'm getting
I
from it is
know.
greater than any risk that I could have. But there is a risk,
Exactly. And
right?
it's
So it's
probably out
like,
there anyway. So yeah,
right, right,
exactly.
right.
Exactly. So, huge, huge fan. I was super excited to see what the announcement came out yesterday, I think, about the Chat GPT or OpenAI for health, and super excited about that. I mean, ideally, and I guess I've heard, right, Amy Gleason's and Kristen Valdez's story over and over again. And, thankfully, I've got two girls, I'm knocking on wood. Thankfully, they've never gone through that. But like even just small things, right? Like being able to access all your data, being able to actually upload that. You're not going to take what Chat GPT says and like that's your diagnosis. You're going to do that, but at least to be educated, right? Like we have to be educated about our own health in this day and age. And I feel like people that just still rely on, providers are still the expert, but you've got to be educated on what's going on, things that you can do, things that you need to know about. And so, holy grail for me is, you should have your test results right away, right? Like that to me. You mentioned your cholesterol, right? Like I also am at that age where my doctor's like having me do all these tests, and first thing I did over the holidays was go and get all my diagnostic testing done, and I was able to see, hey, I was able to read it even before she did, right? Of, here's what the test says. And, I think there's this question about should the patient have it first? Should they have access to their data? Should, they have been able to upload? And to me, it's like in every other aspect of our lives, we're able to have all of our data, we're able to make decisions. So why can't we in healthcare? So, I'm 100% on board of everything that's happening with opening up data, individual access, having all your data, having all your records, being able to upload it and making decisions. And also just grateful for the federal government for saying, hey, we're actually going to enforce on information blocking now, right? Like there is no reason that I as a patient can't go somewhere and get my data. I mean, my older daughter did go through something a couple years ago, and I remember driving down and actually like telling this woman, like, I work in the industry. I am going to report you if you don't, email this person her records, because I knew you could do that, right? And so we
Yeah.
know that in the industry, but all those people that don't, right, and sit around waiting for weeks and weeks and weeks, like it's just so heartbreaking.
Yeah, I just posted this whole story of me trying to get a colonoscopy. I don't know if you saw that, but that
I
got
did it. No.
quite a response. I think like I had a whole bunch of people who were like, "Yep, that's what it is." I tried to basically what happened was I had my annual weight physical, right? And I was like, "Okay, I'm due for colonoscopy. Let me go ahead and schedule." So I'm trying to be proactive,
Right. Right.
proactive patient, trying to take care of their health, trying to save the system money, right, as they say.
Yeah.
And you don't know the hoops I had to jump through to schedule this colonoscopy. So literally, like calling for a week to this
Wow.
center, and they have the system where you sit in queue. I think there was like 40 people in front of me. Every time I called, there's like 40 people in front. So they're like, we'll call you back. They called me back. Of course, their number gets blocked by my spam
Yeah.
blocker. So this kept going on and on. Then they send you to their portal. Their
Yeah.
portal is a 50 question form. That's
Gosh.
just a Word document pretty much that's
Oh,
been put on the web that asks you everything that you can possibly ask somebody about their health. So I had to
wow.
retype my whole medical record, and I'm
Yeah.
like, uh, this is now, and this is a
This is,
pretty big. This is like probably one of the highest volume gastrocolonoscopy clinics in like the Pittsburgh area, and my PCP that referred me there is affiliated with one of the major health systems in the
yeah.
area, and those systems ain't talking to each other. Nothing.
Oh my God.
Nothing. Nothing.
How
There's
does this
not
work?
even, they didn't even attempt to send my information over. All they did is they gave me a piece of paper. Here,
Oh,
go to
wow.
this clinic, schedule your own appointment, figure it out,
Yeah.
and you're on your own. So, like,
Yeah.
how do we fix that?
I know.
Like, is Tefka gonna fix that? I
Right.
don't think so.
I don't
Like,
think so.
Tefka's not fixing that.
Yeah.
That's like business. That's like business decisions.
Yeah.
Like, what
That's
is it gonna make?
that
What's
is
it gonna take?
exactly, yeah, that is exactly it. Like I'm so on board with this whole thing of like it's no longer a technology problem, right? It's truly a business issue. And I am so 100% on that because, we have all the pipes, we can open everything up, we have all the standardization of data. And yeah, the quality, we could probably work on that, right? But it's there. It's not a technology problem anymore. It really truly is a business issue. Yeah, I mean, it's a lot to solve. I think we've made progress, I think, but yeah, I would hate in 20 years, for us to be talking about the same stuff. And, I am watching NCPDP just became a friend of the network for the CMS Align network, which we're super excited about. I kept saying, how do we get signed up? How do we get signed up? And so, at Sequoia Project, they're like, okay, we have a friend of the network. I was like, okay, at least I can monitor, see what we can be doing as NCPDP, things that we can be telling our members to do. So I do
Mhm.
have some hope, with kind of
Yeah,
seeing some of the progress happening there that, maybe we'll actually make a difference and hopefully get rid of some of this stuff. But we have a long ways to go, unfortunately. So yeah, yeah,
yeah, absolutely. But it is exciting because it feels like we are making a little bit of progress here. And like to
yeah,
me, and again, I was trying to, last night I was trying to put my thoughts together on this, my Substack Fire
yeah,
IQ playbook. So I was trying to like say, this was my thoughts about the whole ChatGPT thing. And I think the opportunity is really like twofold. One, it enables us to now be able to drive the action, right? So like
yeah,
help us coordinate as patients in this really complex web of things that structurally are just broken, right? Like talking
yeah,
about this colonoscopy referral system, right?
yeah, yeah,
But then there's like probably thousands of use cases like that, right?
yeah,
So it's really hopeful that AI can start helping us there, right? Like I would love to go and
yeah,
say, schedule me an appointment, like
right, yeah,
reconcile my medications, do all this,
yeah,
and then plug into my pharmacy data, hopefully, and then just
yeah,
like have it refill my medication and then have it remind me to go pick them up because I
yes,
forgot, right?
yeah,
That's the kind
yeah,
of stuff like context-aware reasoning system is really
yeah,
powerful, right? Like it's having a
yeah,
partner that's like, instead of having your spouse tell you, hey,
yeah,
can you go do it? It's
exactly.
reminding you to do that.
Yeah, yeah. Well,
Maybe
and it's
not
been
replacing your
interesting.
spouse. Yeah.
Yeah, and even on the e-prescribing side, like we're seeing a little bit of a shift, right? Because we, talking back to the days of early days at, of Medco and PCS, right? When we were trying to get doctors to e-prescribe, we put in the system of sending the prescription to, the doctor and the pharmacy, right? The patient got left out. And partly was because we're making electronic, right? It used to be I would get my paper prescription and drive to whatever pharmacy I wanted and they would fill it. Now I see our industry coming back around. So it's a lot of times the prescription's going to the patient so they can check how much it's going to cost out of pocket, right? We just recently finished a pilot where, the provider can check if a pharmacy has that medication in stock. And we're actually starting a new pilot where now a patient can check that with our standard. And so we're starting to see, even on the pharmacy side, it coming back around to, we got to get the patient back in the middle of this prescribing experience too, right? Because providers don't have time to be price checking and inventory checking, right? Or to your point, right? Like, let my AI say, hey, I just got this prescription. Like, where can I fill it for the cheapest? How to
Yeah.
set a reminder, like all this stuff that can be happening through our apps and things, right? That we can do if the patient gets back in the middle of the prescribing process. So, it's been interesting to kind of see, like, there are some people that are very excited about that. And, some people are like a little bit leery, but I do see our industry kind of moving that way as well, which I think is great too, because I think that's going to open up so many more opportunities on the medication side for patients as well. So, yeah,
Yeah,
exciting.
absolutely.
So, good.
All right. Well, fascinating conversation. I'm sure we could
I
just keep on
know. We could
going,
probably keep
Pooja.
going on.
So
Yeah,
I want you to promise that you're going to come back, and
I would
maybe
love
in a little
to.
while, we're going to come and talk about more like technical details of the FHIR medication resources and why they were modeled that way, which I'm sure you have some thoughts of. But like,
I do. Yep.
okay, well, thank you so much. This has been terrific.
Thank you.
And I will look forward to seeing all the happenings on the NCPDP and the Pharmacy Working Group on Sequoia
Yeah.
project, as well
Yep.
as HL7 working
Yeah.
groups. I
Yeah.
know we have the Connectathon coming up, and
Yeah.
there's a bunch of pharmacy things.
Yeah, we actually
Think,
have, we're modeling the Connectathon now. We have a thing called NCPDP Collab, where it's we're not necessarily testing all the standards, but having people come in to chat about workflows. And so we're doing that in February. We're starting a new thing that we think is really important for industry as well. And we've got a consumer facing real time benefit check use case, which is a FHIR IG. So, yeah, excited to kind of start our own little kind of, not Connectathon, but collab, where industry
that's
stakeholders can
awesome.
come in.
Yeah.
Yeah, yeah,
So get involved if you're
yes,
in the ecosystem or you're a pharmacy or you're related in the industry.
yeah,
Like, get involved, right?
yeah,
And guess what? Pharmacy can be a leader, right? Or is a
yeah,
leader, is a leader in
yeah,
interoperability. Yeah.
absolutely. And I appreciate the time and opportunity to chat with you. So thanks for having me.
Thank you very much, Pooja. All right. Thank you.